She's walking, and there was honestly a time when I really didn't think that was going to happen. She can say a few words, and she communicates using an iPad. She's seizure-free for 3.5 years. My daughter Harper was born with a brain malformation, and we ended up having to have multiple brain surgeries, and she has a shunt, and so we've been in and out of the hospital quite a bit for her first 2 to 3 years of life. It was really scary. It was heart-wrenching, honestly. She was having a lot of seizures, which was really hard to watch as well. To know that I had that special care for my daughter meant a lot of peace of mind.
General hospitals are equipped to oversee emergencies for all comers. And once you get into very specialized work and specific conditions, that's where a children's hospital really becomes important. Let's say a child comes to the emergency room with a fever. And the fever could be a variety of things. Sometimes it's a simple infection that might go away. But sometimes a fever could be a sign of a more worrisome disease. It could be anything from an autoimmune condition or sometimes even cancer. Most general hospitals are not equipped with specialists to provide support for those kinds of questions. A children's hospital, on the other hand, might have a rheumatologist or an oncologist who can help with the emergency room doctor. We often employ child life specialists whose sole job is to make children comfortable and also understand their environment. So if a nurse is going to come place an IV in a child, we often have a child life specialist first come and speak with the child. They might bring a doll that has an IV in, and the child gets to play with the doll but also understand why that IV might be important. Other services include everything from pet therapy to music therapy to play therapy. These are parts of our normal services when children are in the hospital for a long time and are trying to regain their ability in some form or fashion. And again, we make it fun for them to do that.
They're specialists. They have the experience and the expertise to recognize what's wrong with a child and get the right care to the child at the right time. The Children's Hospital Association of Texas is the voice for the 7 freestanding children's hospitals down at the Capitol here in Austin, as well as with all of the state agencies that govern healthcare. So you've got them in Corpus Christi, you've got them in Houston, Dallas, San Antonio, Austin, Fort Worth, Lubbock. The 7 chat hospitals serve children from 245 of the 254 counties in the state of Texas. And in those 9 counties where there wasn't a child seen by one of our 7 members, that's less than 0.1% of the children in Texas live in those 9 counties. So in essence, we are treating children from all over the state. Our chat members are heavily dependent on Medicaid funding. There are over 3 million children in Texas who are enrolled in Medicaid. So anything that happens around Medicaid severely impacts our children's hospitals. It is really important that these hospitals have a voice in what happens in the Medicaid program because it serves so many of our children.
It would be a grave mistake to take away the resources, what little resources there are available to kids like Harper at a time when they are developing and have the best opportunity for growth and development. So when we're talking about cutting Medicaid or, funding to children's hospitals, we're talking about young kids like Harper who had 30 seizures a day. I mean, if you take away that funding, then you're really not leaving that kid a very good chance later in life.
By investing in us, the legislature is ensuring that those children are productive citizens in the future.